Good morning. Hope we are well. Happy Saturday. We have got our morning sessions lined up, technique sessions this morning where we go over your form, make sure you're doing it properly, safely and effectively, and you have the confidence to know that you are too, because that sure helps rather than just going in on a random home workout and just following along and hoping that you're doing it well. Anyway, hope you're all good. It is World Diabetes Day, and I just wanted to touch on my experiences working in the NHS, Public Health, and with people with diabetes even now still. And it actually brought back a few memories as well of how I all got started with this, because when I was doing my postgrad research, it was in low-calorie diets. My research was low-calorie diets and the compensatory effect of them. So obviously there was around 2014, that was 3 years after Morning Sue, Morning Dawn, 3 years after that, the famous low-calorie diet, which seemed to put type 2 diabetes in remission, which is now being rolled out a little bit more in the NHS in certain areas with certain levels of support. I will say that it's not just like they give you shakes. It's got to be well thought out. So I wanted to look at the compensatory effect of it. So if someone goes on a diet for like quite hard, it was more around fasting, but if someone goes on a low calorie diet, an 800 calorie diet for a few days a week, what happens the rest of the days of the week? Do they overcompensate? And actually what the literature kind of shows, and what I showed as well, was that we don't compensate to actually write that off, because it's not actually pointless, providing there's levels of support in there, like we were chatting to them a lot and giving them information. So it's a difficult one to really put your finger on. Now anyway, at that time, I was volunteering for a children's weight management program, and then an opportunity came up to work in type 2 diabetes in general, to develop a program for people living with the condition or who are at risk of the condition. So luckily I got it, and we put together a 12-week program with accountability, with exercise, with speakers. We had GPs in, we had diabetes specialist nurses, we had dentists who were really big on providing like more information about dental health and diabetes, which only till quite recently wasn't actually talked about a lot, which is quite interesting. And we had dietitians in, obviously myself, exercise side of it as well. And a real big thing was the community we created. We had, every session would be about an hour and a half long. We'd have exercise, then we'd have coffee chat, then the speaker would come on. Now, what I want to touch on with this is that I also did NHS education days where so people would be diagnosed with type 2 diabetes, and then they get sent on a day, that's my thing here, a day of just education. Now this is all good, the education was good, but what it taught me is that we are starving in transformation, but we have overload of information. And the thing that I loved about the 12-week one that we did is that it was weekly, and you've got that thing where you're like, I'll see you next week. I'll do that for next week. Whereas the one day I was a bit like, the difference was incredible in terms of, what do I do now? Like, that was really, and people would leave, and this really hit me a bit, because people would leave and go, that was great. Yeah, I feel much better. But there was nothing practical. Because let's face it, small steps are significant when you keep doing them. So some people would look at something that I've got to make a big change and just downplay the small changes that maybe we've talked about, because there's probably nothing that's going to keep them going with it. They were drowning in information, starving in actually a transformational task that they were going to do. Because the problem is like I said yesterday, if you watched the video, I talked about diabetes, talked about all that area, and about calorie deficits, what's the best diet, is it kind of depends on you. And the problem is, if you're not given something prescriptive, you can fight against it. But two, if you're given something that's so open that you can do anything, it's also unhelpful, because you have so many more choices to make. There's like, which one do I do? And that's where I just want to stress that the level of support that someone receives when doing the low-calorie diet, for type 2 diabetes that's come recently, any diet is normally correlated with the success they have, whether that's someone with a friend, having an accountability friend, like who just keeps you on track. You say out loud, you know, I'm going to do this, and this week. 2 of the ladies on the program right now, it's a really cool thing. They're obviously following along from home on Zoom and on Facebook, wherever they do it. So they're on Zoom, but they're on it together as well. Because obviously on Zoom, only I can see you if you've got your video on. But what they've done is they've set up another Zoom room together so they can see each other and chat whilst they're following the workout. So they're keeping themselves accountable that way. And that's a great way just to get that interaction, get that fun in as well. But the key thing here is that, hey Dawn, hey Lynn, is that if you're not doing what you said you would do already, something's got to change. And you've got to look at what's missing here. Because the one thing I learned from that is that people got better results when there was a community. People get better results when they're around like-minded people. Like everyone in that group had diabetes and everyone was sharing how they felt. And it was like, yeah, I feel like that too. And it's similar with our program. When we have Q&As in, we have people come in talking about menopause. I'm sharing Anna's podcast. She was on the podcast yesterday. She did an interview. I'll share that again tomorrow. And just talk about a bit more detail about her experiences with it. You know, when she was talking about hot flushes. So, and it's just powerful when people share their own experiences of it. Anyway, I just wanted to share that today, because if you're struggling to actually action something, right now your task today is to do one thing. It could be really make it simple, so simple that you can't not do it. Like, I will drink a glass of water before every meal. I will only eat when I'm sat down today. That's a really simple one. Just think how aware you are when you do that. I will only eat when I'm sat down today. Try that one today. Let me know how you get on. Any questions, let me know, and speak soon. Take care.